The University Hospital Amsterdam is one of the most important healthcare facilities in the Netherlands and is also a prestigious research center. The scientists are also investigating new ways to improve compliance in the field of hand hygiene. We met Martien Karis and Mireille Decker to discuss a new approach, nudging, a concept from behavioral economics.
So healthcare workers generally agree that preventing infections is an important part of patient safety. But at the same time, we know that guidelines to prevent infections aren't always adhered to. And it was this discrepancy between what people say and what they do that is what we want to investigate. And the idea was that maybe a reason for this non-compliance was cognitive biases. So cognitive biases are ideas or thoughts that can help us to quickly make judgments. But it can also sometimes have a negative influence. For example, the availability bias means that if we have just seen a very serious infection, then we will consider the odds of that happening again very high. But if we haven't seen an infection for some time, we start to think that maybe it's not so likely. So that could induce some non-compliance. So the psychological approach is very important in hand hygiene behavior. So a nudge or nudging is described as a friendly push to encourage desired behavior. In order for a nudge to be effective, it needs to do two things. First, it needs to be a reminder of what you want people to do. So in our case, it needed to be a reminder to use hand disinfectant. But secondly, it also needs to evoke a reaction. So the point of our research was to investigate if a nudge could make sure that people more often use hand disinfectant. So we then developed posters that did both these things. And we put the posters next to hand disinfectant dispensers that recorded how often they were used. And then we could compare how often they were used with and without the posters. And we found that with the posters, the use of the hand disinfectant was significantly higher.
We found that nudges based on cognitive biases can influence behavior. So the important thing for clinical practice is that nudging can be easy and an inexpensive way to promote compliance.
So nudging can of course not only be applied to hand hygiene, but also to other fields of healthcare. Right now we're looking at ways to incorporate nudging into education, specifically e-learning, to see if we can change behavior in antibiotic prescribing and infection control as well.
Our visit to Amsterdam has shown us that behavioral factors are becoming more relevant for hand hygiene and will continue to be a point of discussion within the infection prevention sector.